Okay, we ready? So we ready to go. All right, guys. So let's talk about the whole entire spectrum here of vessels. This can be a little bit complicated, but I want you to relate it in your notes. So you see the aortic arch. There's three branches coming off. If you lay yourself down in relation to this model, this is right side, this is left side. Remember, everything is due to the patient. So this first branch that is coming about is actually on the right side, and it's called the brachiocephalic trunk. The brachiocephalic trunk will give rise to two vessels. This one is the right common carotid, and this one is the right subclavian. From this next branch over, because look how it flows up, that's going to be the left common carotid, and this one over here is going to be the left subclavian. So there should be some symmetry involved, but this right side kind of jacks things up a little bit. So once again, brachiocephalic trunk gives rise to the right common carotid and the right subclavian. Then direct branches are the left common carotid and the left subclavian. Let's go ahead and follow this down. This right subclavian artery will become the right axillary artery, the right brachial artery, the right radial artery, and the right ulnar artery, and then the dorsal arch there, or the venous arch there. When you talk about these vessels overall, it would be important for us to recognize also that through the abdomen, things are going to change a little bit. This whole entire structure is called the abdominal aorta or descending aorta. I don't care which one you use. This branching point, if you look at this kind of close up, you can see that there are branches coming off of this point. This is called the celiac trunk. The celiac trunk has three branches. Of those branches, one leading to the right side, this whole organ is called the liver. So this is the hepatic artery. This one over here going to the spleen is the splenic artery, and this one up here would be for the stomach, and that's the gastric artery. So you've got three branches coming off of that trunk, and it would be important for you to know that that's the celiac trunk, and it does have three branches. Be able to name them for me, and you'll be good. These two are the renal arteries. They're going to the actual lungs themselves. This guy coming up out at you is called the superior mesenteric, and this is the inferior mesenteric. This is the gonadal artery. So I'm not using the word artery every time, but you should when you take the practical. So all of these are arteries. Now, abdominal aorta then is giving rise to these two structures. Now we're back to symmetry. These are both going to be the common iliac arteries, the internal iliac artery, and the external iliac artery. So one more time, common iliac, internal iliac, external iliac, which is on the same side. That external iliac will become femoral in the leg as you find the femur, popliteal behind the leg, and then anterior tibial through the leg there. Now, something else I'd mentioned to you is understanding that arteries are taking blood away, right? So if you are right here, and I have you on the practical, label this as this is the left femoral artery. Good, you got that right. Then I'm going to ask you, where does blood flow next? And you would answer left popliteal artery. Okay, so you need to understand that arteries flow away. Now, second thing is we'll look at veins. Veins up here. We have a little bit of a different scenario because now all the veins are carrying blood this way back to the heart. But there are two main vessels coming off here. This is the superior vena cava. This is the inferior vena cava. From the superior vena cava, these two vessels are the same, and I don't like this model for this reason, but this and this are the same. I will label it here, but this is the brachiocephalic of the venous system. So this is the left brachiocephalic, this is the right brachiocephalic vein. Both of these brachiocephalics will split into the jugular or the subclavian, right and left respectively. Okay, so brachiocephalic becomes in this case the left jugular vein and the left subclavian, and this right brachiocephalic vein becomes right jugular vein and right subclavian vein. So you kind of got to think about what you're saying here. This is the axillary vein on the right side. This is the basilic vein on the right side. This is the cephalic vein on the right side. This is the median cubital vein on the right side. Okay, now this is going to be the whole entire area of the inferior vena cava. And from the inferior vena cava, you see that there are hepatic veins here. This purple structure is the hepatic portal vein. You also see that there are renal veins going to the kidneys. And then the branching system is the same, where I would have the common iliac vein, the internal iliac vein, and the external iliac vein. Once again, make sure in this case you'd use the left side. Okay. The only vein that you see of the leg, we don't see all the branching like we did in the artery. The only vein we see is the great saphenous vein, and the great saphenous vein runs the whole entire length of the leg, leading then to the dorsal arch of the leg for the venous system, dorsal venous arch. So that is ultimately the vessels of the system. Don't forget, once again, if you're in the vein, let's just say, if you're right here, great saphenous vein, I labeled that. Where does blood flow next? It's going back, so it's going to go into external iliac vein on the right side in this instance. Okay, so that's what you got.